I chose the specialty of facial plastic surgery as well as nose and throat and head and neck surgery because of the variety, the interest, the complexity of the anatomy, as well as the type of patients. I found that in this specialty you see all types of patients, young, children, adults, men, women. So it makes this specialty a very challenging yet intricate specialty where you can help a lot of different areas. For me, the most rewarding aspect about being a doctor is the area of being able to help somebody in the specialty that I've chosen. In the area of the face, there's a lot of challenges, and I see many people that have had significant injuries to their face, trauma, cancers, where they feel like their entire life may be totally disrupted or changed or even ruined because of some of these traumatic injuries. And to me, I found it very rewarding that there's procedures that we can do that are oftentimes extremely life-changing, in that we can correct these deformities, correct these injuries, correct things that people found were very devastating in their life. And on the flip side, I find it very rewarding also, where people come in and they say, I just feel like I'm not myself anymore, my face is aging, or I always hated the way my ears stick out or my nose sticks out, and to adjust these in a very natural setting, in a natural way, to make these patients just feel more comfortable about themselves, to feel more energized, to feel more confident in their setting, just is very rewarding to me. I do all types of procedures of the face and neck. We do the medical procedures, such as helping people with breathing, sinus problems. One of the newest innovations we're doing in the office is balloon sinuplasty, where we can actually open people's sinuses in a painless procedure where there's little to no recovery. We do nose, throat, sinus, all types of surgery. And then we offer the cosmetic procedure, being board certified in facial plastic surgery, with the eyelid surgery, the nose reshaping, the ear surgery, and the aging face, such as the facelift surgeries. With the facelift type procedures, we're using some of the more innovative type procedures, such as the PRP, which is platelet-rich plasma, people's own platelets, which will spray into the wound after the surgery, which decreases the bruising, the swelling, the recovery. The first job I had, I think, helped me with some of my experience as far as how to manage time and practice and life, is that starting in junior high, I started cutting lawns for a living, and it morphed into a profession where I had about 35 lawns that I was cutting full-time. I shouldn't say full-time, in between school and summers, and so it actually helped put me through college and even part of medical school. Involved scheduling and money and personalities, and so it even though it was a totally different profession, I think it helped in some of the later professions that I've done, and it was an interesting job. Part of the recommendations for taking care of the body, and a youthful body, and a healthy body, is starting with the face, nutrition, exercise, protecting the face, and then observation of the face to look for things that may not belong there. Some of the little skin lesions or dark areas that oftentimes we'll say, come on in and we can check. And these things, if when addressed early, can prevent something down the road that could be more worrisome.